Today we will consider enemas and suppositories for constipation. I want to warn you right away, with frequent use of enemas and suppositories, the sensitivity of the rectum decreases, addiction develops, intestinal irritation and allergic reactions may occur. In the future, an independent stool without enemas and suppositories is almost impossible. First of all, it is necessary to find out the cause of constipation, adjust nutrition and drinking regimen, which I talk about in my videos about constipation. I will leave a link to the playlist with all the videos about constipation in the description below. First, let's talk about enemas. Enemas are carried out not only for the purpose of cleansing the colon and eliminating constipation. They are also prescribed before childbirth and surgery, before endoscopic and radiological examinations, transrectal ultrasound examination of the GI tract, as well as for the treatment of poisoning and intoxication. In rare cases, enemas can be prescribed for the administration of medicinal solutions and at very high body temperature to cool the body. Contraindications for the use of enemas are the very first days after surgical intervention, acute inflammatory process in the abdominal cavity, ulcers and inflammation in the rectum, hemorrhoids and internal bleeding, presence of serious heart problems, presence of tumors. Remember that you cannot use solutions that cause irritation of the intestines. These are soap solutions, soda, highly concentrated salt solutions 10% and above, and other fantastic liquids. Strong laxatives and high siphon enemas should be avoided in patients with myocardial infarctions, cerebral hemorrhages, hepatic and renal insufficiency, and other life-threatening conditions. For some patients, a glycerin suppository, a small enema with warm water and vegetable oil at night is sufficient. Indications for use and the type of enema is determined by the doctor. If your doctor recommends an enema at home, you can buy an enema kit without a prescription. Must contain water and salt, mineral oil, or a mild laxative. Buy the kit that your doctor recommends. Do not add anything to it and follow the instructions carefully. Do not try to make your own enema using your own supplies or fluids. Also remember that the rate of action of the enema depends on the specific product and the condition of your bowels. In recent years, microclisms have become widespread. They are used in acute constipation and before medical examinations. Increasing the amount of water due to peptization and liquefaction contributes to the softening of fecal matter and facilitates bowel emptying. Laxative effect comes in 10-15 minutes after the application of microclisms. An example of a microclism is Microlax. Active components in the composition are sodium citrate, sodium lauryl sulfur acetate, and sorbitol solution. Components in the composition of Microlax liquefy the intestinal contents and enhance the laxative effect by stimulating the flow of water into the intestine. Contraindications: hypersensitivity to the components of the drug, bowel obstruction and abdominal pain of unknown origin. Another example of a microclism is Enema Clean. This is a salt laxative based on sodium dihydrophosphate and sodium hydrophosphate. Enema Clean retains fluid in the intestine, which leads to increased peristalsis and subsequent purification of intestines. Contraindications: hypersensitivity, intestinal obstruction, intestinal perforation, acute hemorrhoids, fissures of the anus, ulcerative lesions of the distal GI tract, and children under 18 years of age. Now we move on to suppositories for constipation. One of the effective and mild methods of eliminating constipation is glycerin suppositories. They have a mild irritating effect on the mucous membrane of the rectum and reflexively stimulates peristalsis. Suppositories contribute to the softening of fecal masses. However, with prolonged use, they can cause irritation of the intestine and allergic reactions. Contraindications: hemorrhoids in the acute phase, fissures of the anus, inflammatory diseases and tumors of the rectum, hypersensitivity to glycerol, pregnancy, children under 5 years of age, intestinal obstruction, appendicitis, diarrhea, irritable bowel syndrome. Examples of glycerin suppositories are glycerin and Glycelax. Another type of suppositories for constipation is suppositories with bisacodyl. Suppositories with bisacodyl or bisacodyl cause irritation of the receptor apparatus of the intestine, have a direct effect on the intestinal mucosa, increasing its peristalsis and mucus secretion in the large intestine. These suppositories are used in hypotonic and atonic constipation to regulate feces in conditions such as hemorrhoids, proctitis, fissures of the anus, in preparation for research and surgical operations. Contraindications: intestinal obstruction, pinched hernia, acute inflammatory diseases of the abdominal cavity, abdominal pain of unclear origin, peritonitis, bleeding from the GI tract, uterine bleeding, cystitis, spastic constipation, acute proctitis, acute hemorrhoids. Representatives of this group of suppositories are Gutalax Express and bisacodyl. My dears, both suppositories and enemas are short-term remedies. You cannot use them on a permanent basis. Constipation can and should be cured. Watch the video about 5 ways to eliminate constipation without suppositories, enemas, and pills. Take care of yourself and your intestines. I wish you health, love, and light. Your Dr. Zarifa Romanova.